Durbin, Chief Executive Officer of Support Solutions. Welcome. I want you to enjoy a series of video trainings that we've developed to help you in your work here. As you know, we support nearly 500 people every day, and you are one of over 2,000 employees who are a vital part of that work. We've developed these trainings to assist you on the behavior side and on medical and nursing issues. We believe you'll find this information useful to you as you pursue your everyday performance, and welcome.
Hello, my name is Dee Dee Nelson, and I'm the Director of Nursing for Support Solutions. This is a medication refresher class that's to hopefully be able to get everybody on the same accord to give medications safely to our supported people. We'll have different presenters during the demonstrations to show you how the skills to properly give the medication, and also different people giving medications so that you can see how it can be correctly done in the homes. It is important, as we all know, to follow the 3 checks when giving our medications. You can see the 3 ways that we need to check our medicines prior to giving them to their supported people. It is also important to follow the rights before giving our medication, that it's to the right person, the right position, the right time, the right texture, the right route, the right dose, the right drug. And we know that our supported people also have the right to refuse, and we need to use right documentation when giving our medication.
My name is Vanessa Grant. I am a registered nurse. The objective for the training today is to demonstrate the skilled practice that should be used in the home daily to ensure that supported persons receive their meds the same as the doctor has ordered the meds to be administered. The second objective is to make sure that when you administer the meds, that you read 3 times before the medicine reaches the person to prevent errors from being made. The third objective is to demonstrate, after the person has received the medication, that you do a final read to make sure that the meds were administered as ordered by the PCP, and to make sure that you record to the MAR that the med was administered correctly. When you first start out, you need to gather equipment. The necessary equipment: you should have gloves, you should have medicine cups, drinking cup, hand sanitizer. Make sure they have water in their cup. Any tissue that you need to clean the eyes or ears with for the procedure, as well, a pen to record, and a medication record. You need a supported person to make sure that before you start the process that they wash their hands at the sink with soap and water to prevent the spread of disease or germs, as well as yourself should do the same. Go to the sink and wash before you start the process. The next step should be go to the closet or wherever in the home your MAR and your supply is located to bring to the table wherever you're going to administer the meds at. Okay? When you open your MAR book, you want to find the MAR and look in the hour column on the MAR for the time of day that you're in the home administering the meds to the supported person. You read the MAR. It is 8 a.m. And then you go to the supply and you remove the container from the supply. You do your first read by matching the label to the MAR. The person's name, check Stephanie Smith on the label. On the bottom of the MAR, the person's name, to ensure it's the right person's MAR and it's the right person's medication. Read the script, Colace, 100 milligrams, 2 tablets by mouth every day, and match it. You're matching the label to the MAR. That's the first read. You're going to proceed to give other meds at the same time. You go look at the next med on the MAR, remove the container from the supply, read, Stephanie Smith, Dilantin oral suspension, 125 milligrams per 5 milliliters, 10 milliliters by mouth every day at 8 a.m. Seizures, Dr. Allen House is the reason. Go to the next med in the supply. After you read the MAR, artificial tears, 2 drops in both eyes every day at 8 a.m. Once you have set up all the meds that has to be administered, you look at the meds according to the route. Oral meds are always administered first, okay? So you start a process of eliminating what you're going to start out with first to complete your second and third read before you administer the medication, okay? So I'm going to pick up the Colace first, and I'm going to do a second read. Colace, 100 milligrams, 2 tablets by mouth every day. And then I'm going to wash my hands before I proceed to remove the med from the container and apply my gloves. Then after I apply my gloves, I'm going to find the date of the month that I'm administering the medication, which is today is the 7th, and I'm going to take the medicine cup and place it underneath the dose of a medication that I'm going to remove from the container. So I remove 2 tablets into the cup. Then I proceed to do my third read. Colace, 100 milligrams. I have 2 tablets by mouth every day. Time is 8 a.m. When you're doing your 3 reads, remember you're being observant to the 7 rights. Do you have the right person? Is the person in the right position facing you? And you're facing the person as well in the right position. As I read, I observed the drug name, I observed the dose that I had to administer, and the time that the med had to be administered, and the route, the way the med had to be administered. Always remember, you're reading to be observant to the 7 rights to assure that there are no errors being made in the 7 rights. Now, I'm ready to administer the medication after I did my third read before it reached the supported person. As I give them the medicine, I observe for the swallow, and then I immediately remove my gloves and sanitize my hands. It is time now to record what I just administered. You read the MAR, which is the final read, come across from the time and the date that the med was administered, and write your initials on the MAR to record it immediately after the med was administered, then return the container to the supply. My next medication will be the Dilantin oral suspension. I'm going to read my second read. Dilantin oral suspension, 125 milligrams per 5 milliliters, 10 milliliters by mouth every day at 8 a.m. Seizures. Okay. So I need to shake this. It is a suspension. Some liquid meds you have to shake before you administer. When you remove your top, the tops are not clean. You never know where they've been last. So I take my top off. Remember, the top you want it to always place it against the tabletop, okay, without touching the inside, okay. Pick up my cup, find my measurement on the cup. My dose is 10 milliliters. When you pour liquid meds, make sure the label is in the palm of your hand. Always hold the cup eye level. To get the accurate measurement, never look down in the cup. Protect the label by placing it in the palm of your hands. Okay. Now I'm going to return my top, and I will wash and put my gloves on. I'll do my third read after the med is in the cup. Dilantin oral suspension, 125 milligrams, 5 milliliters. My dose is 10 milliliters by mouth every day, 8 a.m. She's in the right position. She is the right person. And I observe her swallow her medication. Remove my gloves, wash my hands. Final read, Dilantin oral suspension. I gave 10 milliliters. The route was by mouth, and the time I gave it was 8 a.m. I come across from the time on the MAR underneath the date that I administered the meds, and I sign the MAR. And I return the container to the supply. The last med to administer is the artificial tears. I proceed with my second read, artificial tears, 2 drops in both eyes every day at 8 a.m. Because I'm not placing it in the cup this time, I'm gonna go ahead and do my third read, artificial tears, 2 drops in both eyes every day at 8 a.m. Remove the container from the box. Take my top off. Lay my top to the side on the table. Proceed to wash my hands and apply my gloves. I'm going to clean the eyes first. The position for the head should be looking up, never look down. I'm cleaning the eyes so the eyes are closed. You're going to wipe from the inside out. Change your end of your washcloth and clean the other eye to prevent spread germs from one eye to the other eye. Ask the person to look up. Your thumb on the bottom, your forefinger on the top. Never give the eye drops in the person's field of vision. When they see your hands, they'll blink. So you want to get on the outside field of vision to the outer edge and drop and let them blink. Drop and let them blink. Okay? I'm going to turn the dial to the other side so my thumb will fall on the bottom and forefinger on the top, and hold the head back looking up and drop. Let them blink, drop, blink. Any excess, clean the eyes. Now I want to remove my gloves and sanitize according to the guidelines. When we use gloves, always wash before and after using your gloves. I'm going to replace my top now since I'm clean. Put my dropper back in the box, my container back in the box, and I'm going to do my final read. And I'm going to find the time, artificial tears, to make sure I record correctly and that I gave the med the same as the doctor ordered the med to be administered, and place my initials on the MAR. Once I've did my documentation, I'm returning the container to the supply. Now I must verify that my charting is done completely or correct by making sure on the back of the MAR I have my initials, my signature, and my title written legibly so that others can read it. That concludes the demonstration for eye and oral. This demonstration will include the administrations of the route for nasal, ear, inhalation, and patch topical use. Again, gather all necessary equipment. You will need tissue, hand sanitizer, and gloves for this procedure, and a pen to record the meds onto the MAR after you administer the medication. Remember, always wash your hands at the sink with soap and water, the supported person and yourself first before you start the procedure. Go to the closet or the location where the MAR book is at and the supply. Bring it to the designated area in the home that you will administer the meds. Open your MAR book. There should be a photograph on the front of the MAR book to identify your person to make sure that you're administering meds to the correct person. Open the MAR book. Look at your MAR. Look in the hour column on the MAR for the time of day that you're in the home administering the medication. Go to the supply, unlock it, and proceed to remove your containers from the supply. The first one, I'm going to administer eardrops. When I read the MAR, I will match the label with the MAR. Cortisporin. Her name is Stephanie Smith. Identify the name on the MAR and the label. Stephanie Smith, cortisporin, 2 drops right ear every day at 9 p.m. First read. The next med, nicotine patch. Go to the supply, remove the container, match it to the MAR. Stephanie Smith nicotine patch. Apply 1 patch every day at 9 p.m. Tobacco use. Next Med moisturizing nasal spray. I match it to the MAR. First read. 2 sprays each nostril at 9 p.m. Stephanie Smith nasal congestion. Last medication, Pulmicort inhaler. Stephanie Smith 200 micrograms, 1 inhalation every day at 9 p.m. Dr. House asthma. Now, as I look at all the meds that have to be administered at 9 p.m., I start the elimination process. Which one would I administer first and which one I will administer last? All of these routes do not require food or water to administer, okay? So I will start with my eardrops first. Then I will proceed to my nasal spray, then my inhalation, and then my patch last, okay? So as I pick up my eardrops, I proceed to do my second read. Cortisporin, 2 drops, right ear every day at 9 p.m. And because I'm not going to place the medicine in a medicine cup for like oral, I will go ahead and do my third read. Cortisporin, 2 drops, right ear every day at 9 p.m. I will remove my container from the box, set it to the side. The tops are considered not clean, so I take my top off first before I wash with the sanitizer and apply my gloves. My supported person, put them in position. We want the right ear. So this would be her right ear. All right. This is the left one. Make sure I got the right ear, that's right. And I want to position the head to the side, horizontal. And you always want to pull for the adult ear, the ear up and back. Hold the ear up, take the drops and administer the drops. 1 drop, 2 drops. Put the container down and close the earlobe. For 1 ear, you will keep the head over 3 minutes. After 3 minutes up, I need to remove my gloves, wash my hands, and return my top. Now I'm ready to record. Put the container back in the box. Do my final read. Stephanie Smith, Cortisporin, 2 drops, right ear every day at 9 p.m. Come across for my time on the MAR underneath the correct date and initial. Return the container to the supply. My next medication would be the nasal spray. I proceed to do my second read. Moisturizing nasal spray, Stephanie Smith, 2 sprays each nostril at 9 p.m. Nasal congestion. Remove my top, lay my top to the side without contaminating it. Wash, put my gloves on. Close the nostril. Place the container at the tip of the nostril or nasal without touching the skin and spray and to inhale it into the nasal passage, sniff. Close the other nostril. I got 2 sprays. I do another spray, same nostril, spray, sniff. Close the other nostril, spray, sniff, spray, sniff. Lay it down, the container down, remove my gloves, sanitize my hands. Now I can return the top without spreading body fluids. And I go ahead and do my final read. Moisturizing nasal spray, 2 sprays each nostril at 9 p.m. Come across from the time on the MAR up under the correct date. Initial the MAR. return the container to the supply. I'm ready to give my inhaler next, and I must do my second read. Pulmicort inhaler, Stephanie Smith. I'm giving 200 micrograms, 1 inhalation every day at 9 p.m. asthma. Go ahead and proceed to do my third read. Pulmicort inhaler, 200 micrograms, 1 inhalation every day at 9 p.m. Before I remove the top, because this already been in the mouth, I want to go ahead and wash my hands and apply my gloves and then remove my top. Make sure this is shaken prior to administering. It's an aerosol. And I want to place it inside the mouth and tell her to seal her lips around the mouthpiece tightly. On the count of 3, when I spray, I want you to inhale and hold. Hold for 10 seconds and then exhale through the nose. Slowly, I will demonstrate it. 1, 2, 3, spray. Clean the mouthpiece prior to returning the top while you got your gloves on. Okay. Always inspect the inside of the mouth for sores, as people can develop yeast infection from using inhalers. Keep these stored clean in the supply so people do not develop lung infection or any type of infection in the lungs. You can give them a little cup of water to rinse their mouth out after using an inhaler to prevent yeast buildup inside the mouth. Now, I need to do my final read. Pulmicort inhaler, 200 micrograms, 1 inhalation every day at 9. And I need to come across from the time underneath the correct date and initial the MAR that I observed them receive the medication, return the container to the supply. My last med is the patch. Proceed with my second read. Stephanie Smith nicotine patch. Apply 1 patch every day at 9 p.m. My third read, since it's not going into the cup, is topical. Nicotine patch. Apply 1 patch every day at 9 p.m. Tobacco use. Remove my patch. Remember, always look for the patch where it was applied last. Before touching the doll, you want to make sure with the patch, you wash your hands. Remove the outer covering to the patch. Put the time on the patch that you're administering the meds and the date, month, date, and year. Apply the gloves. Remove the patch that was there previously. Rotate the site. Never put the patch in the same area because it irritates the skin. When you look on the back of your MAR, you have sites where you rotate the patch and you use codes to document on the MAR where you applied the patch. So I'm going to clean the skin before I apply the patch. And I'm going to let it dry, and I'm going to apply the patch. Remove my gloves, wash my hands, do my final read. Nicotine patch. Apply 1 patch every day at 9 p.m. Find my time and come across from 9 p.m. Find the date and initial the MAR. Underneath my initials, I'm going to put the code for where I applied the patch. Right on. Code is RA. Come across from site underneath my initials and write RA for the site I applied the patch. Turn on the back to finalize my charting to make sure it's all correct and complete. Verify my initial, my signature, and my title one time for the whole month. Now I return the container to the supply. Secure the supply, return it to the location where I removed it from with the mark. This demonstration will include rectal, vaginal, and topical use for skin. Again, gather all your necessary equipment that you need: gloves, hand sanitizer. You will need a sanitary napkin for vaginal use, a brief to put up on your supported person for rectal use, a pen to record your meds immediately after you administer the medication. Remember, always wash your hands to prevent the spread of disease and germs, as well as the supported person. Go to the location where the MAR and the supply is located. Remove, bring to the designated area in the home you're going to administer the meds. To provide privacy, we always want to administer rectal and vaginal in a room to provide privacy before administering the meds. Again, open your MAR book. Identify your patient to make sure it's the right person. Then remove your MAR and read. Look in the hour column for the time of day that you're in the home to administer the medication. Okay. And proceed to remove your containers from the supply. I will be administering to Stephanie Smith a saline enema, Fleet, 1 bottle rectally every 3 days at 8 p.m. First read. She will also receive a monostat vaginal suppository. Insert 1 suppository vaginally at 8 p.m. Yeast infection. Topical use. Stephanie will receive hydrocortisone cream applied to rash on left wrist every day at 8 p.m. As I look at what I'm administering, I'll start the process of elimination. And I will administer the cream first. So I will proceed with my second read. Hydrocortisone cream applied to rash on left wrist at 8 p.m. Dermatitis. Third read, hydrocortisone cream applied to rash on left wrist every day at 8 p.m. Dermatitis. I'm going to remove my container from the box. Verify it's the right med in the box. And I'm going to flip my top. Proceed to wash my hands. Because my right hand is my dominant hand, it will be my dirty hand because that's my working hand. My left hand is my clean hand. So I always want to make sure whenever I pick the tube up, I pick it up with the clean hand. Never take my hands and cross. Never take clean and touch with dirty. You want to keep them separated during the procedure. Just demonstrate clean technique. Okay. So I got my gloves on and get my patient. And she's laying in the bed, and we want her left wrist. Okay. She just has a rash on the left wrist. So you observe the location where you're going to apply the med. Before applying it, always make sure it's clean, skin look clean. And I'm going to go ahead and take the tube with my clean hand. Pick it up. You can apply the cream to the skin and rub it in, or you can apply it to a clean glove and rub it into the skin. When you apply the medicine, always from the center of the location of the area and rub in a circular motion out, away from the site. Never go back to the beginning in the center because you're going from clean back. You're going from dirty to clean. Okay, so in a circular motion, out, away. Okay, not a lot, just a small amount, enough to get it absorbed into the skin. When I get through, I'm going to set my tube down and I'm going to take my gloves off and wash my hands. Flip the top. Return it to the box. Final read. Hydrocortisone cream applied to rash on left wrist every day at 9 p.m. Find my time, come across on the correct date, initial. Return container to supply. Okay. While we're in the room, I'm going to go ahead and administer vaginal. So her name is Stephanie Smith. Check the label. And it's Monostat vaginal suppository. Insert 1 suppository vaginally at 8 p.m. Second read, Stephanie Smith, Monostat vaginal suppository. Insert 1 suppository vaginally at 8 p.m. Take my suppository from the box. Make sure I place my applicator on a clean surface. I got my sanitary pad. I need to prep the medication. Remove all your outer coverings, put it into the applicator. But before I do it, I'm going to check it again because I had to prep this dose of medicine myself to make sure I prepped it correctly according to the orders. Monostat vaginal suppository. Insert 1 suppository vaginally at 8 p.m. Take your hand and your thumb and your forefinger. Spread the labial lips apart. Tell the person to take a deep breath and insert the applicator into the vaginal tract as far as it'll go and push the plunger on the applicator in to release the medicine inside the vaginal area. Remove the applicator and dispose of it. Remember, while you have your gloves on, place your sanitary pad. Always instruct the supported person to stay down at least 10 to 30 minutes after administering vaginal medicine so it doesn't drain out the person's body. Remove your gloves, wash your hands. Final read. Monostat vaginal suppository. Insert 1 vaginally at 8 p.m. Go to the 7th, cross from your time, initial the MAR, return the container to the supply. Okay, while she's in the room, we're going to go ahead and administer the enema. And I do my second read, saline enema, fleet, 1 bottle rectally every 3 days at 8 p.m. I'm going to go ahead and do my third read, Stephanie Smith, saline enema, 1 bottle rectally every 3 days at 8 p.m. And I can go ahead and take my top off. I'm going to leave it on because I want the water to get off. But I'm going to proceed to wash and put my gloves on. The position should be on the left side with the person's back facing you. I'm going to take my thumb and pull the upper cheek up to administer this medication so I can see the rectal opening. Tell her to take a deep breath. As I insert, I go in a slant toward the back wall. I take my thumb that's holding the upper skin of the buttock and press down to try to seal it because she's going to have an urge to push. So to try to get rid of some of that urge to push, as I'm squeezing, I'm telling her to hold. Don't push. Don't push. Okay? Don't push. If you see any draining out, that means she's pushing, so you're going to have to intervene and support the hole. Come out and push down. Don't leave it open because you push what you already administered out. Hold it for at least 10 minutes until you think the urge for the push has passed. Once the urge to push has passed, you can go ahead and close them up in the brief and let them know it'll be 2 to 5 minutes before you have an urge to push what was in out. So try to hold it as much as you can, but in 2 to 5 minutes, you're going to have an urge to push what's in out. Okay. And I'm going to go ahead, since my label is on my container, I'm going to final read while I got my gloves on. Stephanie Smith saline enema, 1 bottle rectally every 3 days at 8 p.m. Dispose of the bottle because it's one use. Then I'm going to take my gloves off, wash my hands, and I'm going to read the MAR, find the time I gave the med and the medication drug name, and initial the MAR. Always check to make sure your charting is complete or done correctly at the end by assuring that your initial, your signature, and your title is on the back of the MAR one time for the entire month. That concludes my demonstration of all the routes for administering medications according to the skills safely to the supported persons in the home to make sure that we are not making errors. Always read before you administer medication. Thank you.
This next section is we're going to have a demonstration with a supported person and the DSP to be giving the medications to our supported people. I want you to watch the video to see what times you think if the meds are given correctly or if the meds are given incorrectly, and look to see what you think could be done better.
JD, my man, it's time for you to take that afternoon med. You ready? All right, great. I already know that this yours because your name right there, but I know you're supposed to take these pills anyway. Here you go. There you go, JD. Okay, JD, thanks for taking your med.
Peter, we're going to take our meds so we can head out into the community. Ready?
Leave me alone.
Peter, everything I do is for your benefit, okay? I want you to have your meds so we can continue to go out in the community and do fun stuff. Cool?
I tell you, leave me alone.
You want to take your meds so we can leave the
You
house?
gonna leave me alone? I take my med.
I absolutely will leave you alone. Okay. So
Want no water? Leave me alone.
okay, Peter. I'll just document and we'll just try another time, okay? Are you refusing to take your 4 o'clock med? Okay. You know, if you don't want to take your meds, you could have just said so earlier. You didn't have to wait until 4 o'clock. You know? Just think about what you've done.
Hey, Peter.
Hi.
It's time for you to take your meds. Have you washed your hands at the sink with soap and water?
No, ma'am, I haven't.
Okay, you want to go wash your hands right quick?
No.
Well, let's use a little sanitizer then. Sanitize your hands.
No, I can use that.
Okay. All right, got your MAR. I'm gonna look at your MAR and see what medication you're gonna get at 4 o'clock. And you got blood pressure medication you gotta have. Okay. So, low pressure.
Do I gotta take that medicine? I don't like that.
Well, you know, it's for your blood pressure, to stabilize your blood pressure so you don't have those headaches and lightheaded and dizzy.
Yes, ma'am.
Okay?
Yes, ma'am.
And it makes you not have those headaches all the time like you've been having. Okay? It should help.
Yes, ma'am.
Stop the headaches. Okay? All right. So I got low pressure, 50 milligrams, 2 tablets by mouth every day, 4 p.m. And check it again. Low pressure, 50 milligrams, 2 tablets by mouth every day at 4 p.m. Watch me put my gloves on and get me a medicine cup. And I'm looking for today's date. Punch. 2 tablets. Check it again. Low pressure, 50 milligrams, 2 tablets by mouth every day. Blood pressure, Peter Wright. Okay, Peter Wright. Alrighty. I'm gonna sit up straight. Need some water. All right, good. How you feeling?
I'm just gonna talk to them now.
Okay. Did you swallow it?
No.
No mouth. Okay. I don't see it. You swallow it. Okay. Take my gloves off. Wash my hands. 50 milligrams, 2 pills per night every day. 4 p.m. Wait. Issue.
Now can we go to the scanner center?
Sure, let's get ready to go.
All right.
Okay.
This next section is about the medication policy. Please read along, as you can see on the screen, of the medication policy. There will be a quiz at the end for you to review. This is the Support Solutions of Tennessee Medication Administration Policy and Procedure for Community Services. This is in the Policy and Procedure book as policy number 55. You have your table of contents, and then we have the purpose of the med policy with the medication prohibitions, self-administration, staff requirements, and program requirements. The body of the medication policy starts with the documentation of the medication administration record. All medications, whether prescription or over-the-counter, must be treated as follows. All orders must be written on a physician order sheet or prescription form signed by the treating physician. Each order needs to have the date ordered, the name of the person, name of the drug, dosage, route, frequency and duration of administration, any pre-test orders, and the treating physician's signature. Some medications will be ordered as how many milligrams, such as Tylenol 650 milligrams, or a Tylenol tablet is 325 milligrams. Therefore, the prescribed doses might be 2 tablets of Tylenol, which will give you the same required dose of 650 milligrams. Some medications have specific intervals, such as give a half an hour before the stated time and no later than a half an hour over the stated time, such as an antibiotic, erythromycin. There is an acceptable window of time for administering medications to a person. Sometimes the doctor orders parameters to withhold a medicine, such as digitalis, if a pulse rate is less than 60. If the medication is ordered for a set number of days, the start and stop date must be noted, such as an antibiotic that's given for 7 or 10 days. Sometimes there are special considerations for administration that must be listed, such as giving a half an hour before meals or given half an hour after meals. Medications that are ordered as needed are administered by certified staff only when the parameters for it are used and clearly identified, such as the Tylenol to be given by mouth every 4 hours PRN for temperature greater than 100 degrees orally. Staff will not administer PRN medications when the parameters for the administration are not clearly identified, administered on a medication order that does not comply with DMRS regulations, or medication orders that will not be ordered if ranges are given until clarified by the physician. As a side note, psychotropic meds that are ordered PRN can only be given by the RN. So Support Solutions tries to avoid having any PRN psychotropic meds. The MAR book is kept in a separate notebook. The medication orders recorded on the MAR must be transcribed exactly as written physician's order. Certified staff designated to administer meds, including the order over-the-counter medicines and treatments, will be responsible for documenting on the MAR. Blank spaces are not acceptable. If an ordered medicine is not given for any reason, the medication block must be initialed and circled, and the reason why it's not given recorded on the back of the MAR. An example is omitted, refused, withheld, not available, given in another form like liquid or suppository, given in another route, given in another strength, documentation error. Draw a line through blocks indicating the days the medication is not to be administered. Example is the medication is ordered for every other day. The documentation of medication administration given out of the home should be documented using the following codes: P for program, V for visit or vacation, H is for hospital. And remember that if the medication is given off-site, there is a leave of absence form where you count the pills and have the person receiving the medication sign the form. Any change in the treating physician's medication order will be considered a new order and will be documented as such on the MAR. You'll need to discontinue the old medication order and start over with a new block with the new order. Anytime that there is a medication change, this change must be communicated to other staff as follows: verbally reporting, documenting the changes in the shift log or communication book, documenting in the person's record. The next section is editing medication records. The MAR will be edited monthly for completeness and accuracy to ensure that all medication orders correlate with the physician order sheets. The certified staff performing the editing will place an entry on the back of the new MAR as compared to the current MAR. New orders not appearing on the current MAR must be compared to the signed physician orders for completeness. There are 3 quality checks. That completes the first check. Another quality check is then performed by another certified staff. Compare the edited MARs with the signed physician orders or prescriptions. Any discrepancy in the medication records must be clarified by the pharmacist or the treating physician if necessary. A final check by a certified staff is done prior to the administration of the first day of the month. This is done to ensure that any new orders written since the day of the medication records were edited and the first day of the month are transcribed completely and correctly. A nurse needs to be one of the checks done with editing the MARs. Documentation of the controlled substances. All Schedule 2-7 meds are to be documented in a different way. There's another video that shows some more explanation of the controlled medicines that you can watch if you need extra information. There is a count to be done where the narcotic control count sheets are in the MAR book so that you sign off on the control count sheet and on the medication record. The count must be done at the end of the shift in the presence of 2 staff. There was an addendum that updated this, that it needs to be 1 certified staff and now 1 non-certified staff can simply count the pills to make sure that the pills count is correct. The oncoming certified staff must count the medicines, confirm the given doses, and verify that the count and documentation are correct by signing the count sheet. Discrepancies in the drug count sheet or suspected theft must be reported immediately to the agency director or designee. In addition, any drug loss or excess must also be reported. The agency director or designee must report these discrepancies to the DIDS nursing department also. Medication refusals. If a person refuses any form of the medication in an effort to determine the basis for the medication refusal, several attempts, at least 3, must be made within an hour before or an hour after the stated time of administration before documenting this as a refusal. If the refusal of medications persists, the person's circle of support or behavior support should be notified to determine the reason for the refusal. At no time will the missed dose be made up at the next scheduled medication dosage. Leave of absence. This is when medications will be administered by a parent, family member, or guardian, or other individuals having close relationship with the person. Right here is an example of our leave of absence form so that you can see that the medications must be counted and signed off by the support solutions person and by the person that will be responsible for the medications while the supported person is away from the home. The next section is on medication variances, omission reporting, management, and tracking. For medication variances and omissions, there is, when we do not follow the 7 rights, then we have a medication variant. Appendix 6 shows the sample of the medication variance. There is a form to be filled out that's at the back of this med policy that you will see about filling out medication variances. Corrective actions. In determining what corrective action will be taken, the following factors relative for potential harm will be taken into account. Technical assistance and emergency protocol. Persons receiving medication may experience side effects or adverse reactions to their medications, resulting in emergency, urgent, or non-emergency situations. In this event, such situations occur. The measures listed below should be followed. Always call 911 if there's any life-threatening situations such as extreme difficulty breathing, absence of pulse, a seizure that does not stop, as just examples. Non-emergency conditions that are potentially health-threatening, such as mild diarrhea, nausea, occasional vomiting, or any other physical or behavioral symptoms, which may include the health and safety of the person at risk, must be reported as soon as possible. Staff must report their findings to the on-duty RN, LPN, house manager, shift supervisor, day program supervisor, or administrator designee to seek advice and assistance. If there is a non-emergency question about a medication, its administration or side effect, or agency licensed nurse is not available, staff should contact the pharmacist, treating physician, or emergency room for help in that order. Any contraindications, food or drug interactions, and or possible allergic reactions and sensitivity, special precautions, common risk, side effects, adverse reactions, and contraindications of the drug, conditions or illness for which the drug is commonly prescribed, special considerations that should be noted. An example: give with water, encourage fluid intake, give with food, or any other circumstances. Note that medication profile sheets and or one or more reference books listed in Appendix 2 may be used for this purpose. Medication disposal. Medications must be destroyed when they are contaminated, refused, discontinued, expired, or missing labels. To dispose of medication, 2 certified persons must be present to witness the disposal. Generally, here at Support Solutions, you bring your disposable medicines up to the nursing office, and the nurses will help with the disposal process. The next section of the policy is medication storage and labeling. Prescription and over-the-counter medicines for all people, including those who are self-administering, must be labeled and stored in a locked container or an area that is designated strictly for medication storage, supplies, and records available. People who are self-administering must be stored in such a way as they make them inaccessible to all other persons. Only certified staff assigned to medication administration for the staff will have access to the storage areas. Prescription medications must be stored under the person's name in hanging files, plastic bags, or bins. External and internal medications must be stored separately. An example is in a different box or in separate Ziploc bags. All Schedule 2 to 7 medications must be kept double locked. That's like in a locked box in a locked cabinet or closet. At Support Solutions, we generally have all our medications under double lock. That way, everybody can rest assured that they have following this policy. Medication requiring refrigeration must be stored in a locked container within the house refrigerator or in a separate locked refrigerator. If a person receives medication at 2 different sites, a prescription must be obtained from the pharmacy to use at each site. Medication labels that do not reflect the current treating physician's order due to a recent change in the order must be returned to the pharmacy for repackaging. Any medication containers with illegible labels must be returned to the pharmacy for repackaging or disposal to get a replacement from the pharmacy. Security is the agency's responsibility to have designated certified staff to administer medication. The next section is documentation of the addendums. There's a list right here of the emergency telephone numbers that need to be accessible to people in case of an emergency. The next Appendix 3 is the appendix of the medication record. Your medication record will look similar to this depending on what pharmacy is being used. Appendix 4 is the proper procedure for passing medication. The next, Appendix 5, is Tennessee annotated list of drugs that are scheduled. These are available for you in your med policy. We will not show the whole list because it is a very intense, long list. Support Solutions medication oversight for the unlicensed person. Monitoring will occur each calendar month. Monitor is reviewed by nursing monthly. If you are monitored with your medication observation and you do not have a passing score, the nurse will work with you or the designated staff. There is also a medication administration review test that you will be given to make sure that you are safe to give medications. If you still are not comfortable with giving medications, then the nurse has the option to put you through a medication refresher course or have you to go through the whole medication class. And physician orders, an example is given to you. There is also in the medication policy a certain procedure if a person is going to self-administer. Here's the plan. The nurse will work with you as far as getting the circle of support on board. There must be a physician order signed and it must be reflected in the ISP. There's an addendum 3 to the medication policy that concerns the PRN medications and the labels. Here's the addendum 3. The addendum 4 discusses that we will contact the nurse educator to verify medication certificates that are valid before allowing employees to administer medications. Support Solutions will ensure that the medication administration certification is updated prior to the 2-year exam. The next is a medication refill addendum. This policy tells the procedure for getting medications refilled. Routine medicines are prescriptions are faxed to the MD appointments. After hours, there is a system that each office has as far as getting after hours prescriptions. People are not to be without their medications, so it is up to us to make sure that there's a continuity of care with our medication refills. The next addendum involves the documentation of the count sheet that we've discussed earlier, where one certified staff and a witness is acceptable. This concludes the medication administration record for Tennessee. Here at Support Solutions, the nursing department appreciates all your time and effort that you spent today on this training video. If you have any questions, you are welcome to call your nurse at your office at any time. A nurse is available for you 24 hours a day, 7 days a week, weekend and holidays included. And I appreciate all your time and effort. For some offices, there is a quiz after watching the training video for you to complete. Thank you.